Welcome. I'll ask you to take your seats, please. My name is Joanna Cohn. I'm director of the Institute for Global Tobacco Control here at the School of Public Health. And it's my very great pleasure to introduce today's speaker for our Innovations in Tobacco Control seminar series. And our speaker today is Dr. Xisca Sureda from Spain. She's a visiting scholar with us for a couple of months. This is her first week, more or less, so we're just so pleased that she's able to share some of her work with us. Dr. Sureda is an assistant professor in epidemiology and public health in the Department of Surgery, Medical and Social Science at Alcalá University. She has her PhD in medicine from the University of Barcelona, and she did some work for a couple of months at the University of California, San Francisco in their Center for Tobacco Control Research and Education. Her areas of interest are tobacco and alcohol epidemiology and social epidemiology, and she's been very interested in the impacts of smoke-free policies on changes in behaviors, including smoking behaviors, as well as exposure to secondhand smoke. And she currently has a couple of funded projects in Spain that are studying how the urban environment in relation to tobacco and alcohol are related to smoking and drinking behaviors. So today we're very pleased to have her talk to us about her work on secondhand smoke exposure outdoors and some of the challenges associated with that. So thank you.
Hello. Thank you, Joanna, for your kind introduction and for inviting me to present some of the work I have conducted in Spain. It's a pleasure for me to be here today. And I would also want to thank you for the opportunity to be at the Institute for Global Tobacco Control during these 2 months, learning from all of you. You have incredible projects and incredible people, and I have too much to learn from you during this period. So I will tell you for the next 30-40 minutes about secondhand smoke outdoors, but I will also tell you a story. I will try to summarize what has happened in Spain in the last 10 years in relation to smoke-free policies as an introduction to the main topic today. And then I will show you the results of 2 different published studies we conducted in Spain and 1 ongoing project in relation to secondhand smoke exposure outdoors. And at the end, we will have time to discuss if outdoor smoke-free policies should be or not in the agenda of policymakers. In 2013, Spain was in the 7th position out of 34 countries in Europe according to the tobacco control scale. Although the country was far to get the maximum score on taxes, health warnings, or help people to quit smoking, we almost reached the maximum score in banning smoking in public places. On 1 January 2006, a smoke-free legislation was implemented in Spain to protect the health of non-smokers and ban smoking in all enclosed public places and indoor workplaces. But this law has important exceptions in hospitality venues, according to its size. So in that venues less than 100 square meters, smoking was prohibited or allowed according to the owner's decision. And in those venues equal or more than 100 square meters, smoking was banned, but owners could have smoking areas inside the venue. This partial law in Spain was promoted by the tobacco industry as the Spanish model, as an alternative to 100% smoke-free policies and as to be fair to everyone. The Spanish law could be used as an example of the accommodation programs by Philip Morris that include the courtesy of choice, referring to these smoking areas that separate the smokers from non-smokers, and the traditional hospitality, referring to the smaller venues that could choose if smoking or not inside the venues. They claimed that these programs facilitate reasonable accommodation and preserve the social acceptability of smoking. And this model was followed by other countries apart from Spain. Some previous studies we conducted in Spain to evaluate that law. So we conduct different studies to evaluate changes in tobacco consumption, secondhand smoke exposure, and impact on health and economics. And those evaluations chose a high acceptance of the law 1 year after its implementations. And it also chose a reduction of secondhand smoke exposure at workplace of 90%, with no changes in secondhand smoke exposure at home or during leisure time. In hospitality venues, we observed different results. In those hospitality venues that ban smoking indoors, there were nicotine reductions of 50% and respiratory symptoms reductions of 70% among its workers. However, in places where smoking was allowed or they have smoking areas, no changes in secondhand smoke exposure or respiratory symptoms was observed among its workers. So this result showed that part of the population was still unprotected from the effects of the law. The evidence provided by the scientific evaluation suggested that there was a need to promote a change to a comprehensive law. Other factors help on the way to that change, including creating a positive social climate and acceptability of smoke-free legislation. Our research results constantly appears on media to show the positive effects of the law, but that part of the population was still unprotected. We got support from keepers at the regional and national public health administrations, and advocacy from politicians, citizens association, trade union, journalists, or public health association. On 2nd January 2011, Spain implemented a new law that reinforced the previous one, banning smoking in all public places and workplaces, including hospitality venues. And it was the first time in Europe that the law also includes some outdoor places, including hospital campus, schools and high school courtyards, and children playgrounds. And it also banned smoking in terraces that are outdoor sitting places in hospitality venues when they have a roof and more than 2 walls. And since I'm not sure if you are familiar with terraces, I will show you some examples of these outdoor sitting places in hospitality venues that are very common in Spain. So in Spain, we love going to bars and restaurants, and we almost have wild hot weather during Colia. So having these places on the streets are very common. So on the left side, the left part of the slide, you can see terraces where it would be banned smoking according to the law. So in the image above, you see a terrace with a roof and 4 walls that could be comparable to an indoor space. And the image below, you see a terrace with a roof and 3 walls. On the right part of the slide, you can see 2 examples of terraces where you could smoke according to the law. In the image above, there is a terrace with one wall and 1 roof. And in the image below, you can see a completely open space. Although we have now some outdoor places where smoking is prohibited, some smoke-free policies may motivate smokers to relocate to outdoor places not regulated by the law, such as streets, public main building entrances, parks, green spaces, and other examples. But it's also very common to see smokers in outdoor hospitality venues, including their main entrances and terraces, even in those where it would be prohibited according to the law. So according to some research, in 87% of terraces in Spain, where it would be prohibited to smoke by the law was not enforced. Some controversy exists regarding if it should be prohibited or not to smoke in outdoor places. Those who oppose to those policies claim that it is ethically unsustainable because it does not respect the principle of freedom and autonomy of individuals. And they say that there is insufficient evidence that secondhand smoke in these environments has an impact on health. Those who are in favor of those policies said that these policies may help to denormalize smoking, that they establish a positive smoke-free model for youth, they reduce youth opportunities to smoke, reduce secondhand smoke exposure, and has benefits also for the environment. We published some years ago a systematic review of the literature that measures secondhand smoke exposure in open and semi-open settings using tobacco biomarkers and environmental markers. This paper was published in Environmental Health Perspective in the year 2013. We found 18 published articles that met our inclusion criteria. Most of the studies use PM2.5 concentration to characterize secondhand smoke levels in outdoor places. I show you here, in that figure, PM2.5 concentrations obtained in outdoor settings within the included study according to the setting, hospitality venues versus other settings, and according to the presence of smokers or not. The size indicates the number of settings included in each of the articles, and the red lines indicate the annual and the 24 hours values recommended not to exceed by the WHO organization, air quality guidelines. According to our results, we found a considerable number of studies where they obtained PM2.5 concentrations above the recommended values by the WHO organization, especially in hospitality venues and in the presence of smokers. So now I will present you two works already published and one ongoing study. So the first piece of work was titled Secondhand Smoke Levels in Public Buildings, Main Entrances, Outdoor and Indoor PM2.5 Assessment. It was published in Tobacco Control in 2012. And the aim was to assess secondhand smoke levels in halls and main entrances, outdoors, in public buildings by measuring PM2.5. This is a cross-sectional study in a sample of 47 buildings, public buildings in Barcelona, Spain, conducted between April and May 2010. We defined 4 different locations at each building to measure secondhand smoke exposure. And here in that figure, you can see represented the 4 places, the 4 locations, and repeated colors represent simultaneous measurement. We measure in the hall, that was defined as the interior space adjacent to an outdoor areas. We measure in the main entrances outdoors. That was the area within a radius of 5 meters over the door with direct access to public road. And we measured in 2 controls, one indoor and one outdoor. And the control indoor was defined as a room physically separated from the main entrance and at least 10 meters from that entrances. And the control outdoor was the nearby outdoor space located more than 10 meters from the main entrance outdoors and where smoking was not present. So we measured PM2.5 using 2 pre-calibrated handheld-operated monitors of particle size and mass concentrations. The fieldwork took place on weekdays between 9 a.m. and 5 p.m. when most workers and visitors attend the building. And we include public administrations, educational places, work, transportation stations, and healthcare centers. We recorded signs of tobacco consumption and physical characteristics of the setting. For example, if the entrance outdoors was completely closed or quasi an outdoor space. So if there were like roofs and walls in the main entrance. So in that figure, you can see the PM2.5 concentrations obtained according to the setting. And you can see that the PM2.5 concentrations obtained in the hall and main entrance were very similar and higher than those obtained in both controls, both indoor and outdoor. And in figure 2, you can see the real-time plots of 10-second average values of PM2.5 concentration during a measurement session in one public building. So the figure above represents measures, simultaneous measures in hall and main entrance outdoor. PM2.5 levels in both settings are very similar through all the measurement, with the spikes that represent moments when there were people smoking in the main entrance, and levels of PM2.5 increase accordingly. The figure below represents simultaneous measures in main entrances and in the control indoor. The level in the control indoor is flat, while the levels in the hall are much higher and varies depending on the number of smokers that were present in the main entrances outdoors. So in the hall was forbidden, was prohibited to smoke according to the ban, but PM2.5 concentrations reach important levels of secondhand smoke exposure, indicating that secondhand smoke exposure from outdoors may drift to the indoor spaces. The second piece of work was published in PMG Open in 2015 with the aim of describing tobacco consumption and secondhand smoke exposure in outdoor areas and to evaluate the opinions and beliefs of adult population towards tobacco control policies in these areas. This is a cross-sectional study, including a representative random sample of adult population in Barcelona. This takes part of the DCOT2 study, Determinants of Nicotine, that it was a pre-post evaluation study of the smoke-free laws implemented in Spain. And for the present study, we used the information collected between June 2011 and March 2012 after the comprehensive law was implemented. We only include data of the post-period, since in the pre-period we didn't have information about outdoor areas. We use a face-to-face questionnaire assisted by computer that includes information on tobacco consumption in outdoor settings, secondhand smoke exposure in outdoor settings, and public support for outdoor smoke-free policies. So we got data of 379 smokers, and smokers reported smoking outdoors, most in bars and restaurants, followed by outdoor places at work. According to non-smokers, outdoor secondhand smoke exposure was highest at home and in bars and restaurants. And among non-smoking students, 90% claim exposure to secondhand smoke on university campus. There was a great support for banning smoking in the majority of outdoor areas, which was higher among non-smokers than smokers. And over 70% of the participants supporting smoke-free places in playgrounds, school and high schools, courtyards, and grounds of healthcare centers. And these three places were already smoke-free according to the law. And this is the project we are conducting now in Madrid. This project has the main objective to characterize tobacco environment in the city of Madrid in terms of availability and accessibility to tobacco products and secondhand smoke exposure outdoors. We try to describe if there are differences within the city, depending on the socio-demographic and socioeconomic characteristics of the neighborhoods. And we also try to understand how these tobacco environments relates with self-reported secondhand smoke exposure and tobacco consumption. So I will explain now how we describe smoking visibility and secondhand smoke places and the results obtained in hospitality venues. This project was funded by the Instituto de Salud Carlos III, that it would be the NIH here in United States, and the European Research Council. This is an observational study conducted in Madrid City in 2016. We selected 42 census tracts scattered around the city and representative in terms of socio-demographic and socioeconomic characteristics, and field workers walk along all sides of the street located within the chosen census tract to characterize all outdoor places, including hospitality venues. The route in its census section was previously defined using a map that the observers follow the day of the observation. We adapted a tobacco questionnaire that had already been used in previous studies to characterize outdoor public spaces, including hospitality venues, public transportations, stops and stations, and entrances of public buildings, healthcare centers, school and high schools, and also children playgrounds and other public places of interest, like open market, green spaces, parks. So everything that could be collected from the street without getting into the building or premises. The instrument was integrated in a digital application called Open Data Kit Collect. These applications allow data collection via mobile phone, including the possibility of taking pictures and geolocating the data using GPS. The questionnaire includes information on general characteristics of the measures, like date and time of the measure, the address and type of outdoor setting. We include information on signs of tobacco consumption, number of smokers, presence of ashtrays, cigarette butts, tobacco smell, and for hospitality venues, we recorded information for both outdoor main entrances and terraces, if present. And each hospitality venue, we also recorded the characteristics of the terrace, including the number of tables and number of roof and walls, and characteristics of the outdoor main entrances, presence of tables, barrels, or similar. And this was important for main entrances because when our owners don't have permission to have a terrace, they put like tables and barrels to facilitate the smoking outdoors. And I will show you later some examples of pictures taken in the streets. So when hospitality venues has a terrace, we measure PM2.5 and nicotine concentrations in a central point of the terrace for a period of 30-45 minutes. We collected the time of onset and completion and total number of smokers and lit cigarettes during the airborne marker measurements. Field visits took place between May and September 2016 on weekdays between 5 and 9 p.m. Between October and December 2016, the observers repeated the measurements in 11 census sections to compare results between seasons. So I will show you the first set of preliminary results of this project to describe the visibility and secondhand smoke exposure in outdoor hospitality venues in Madrid City, Spain. And we will be submitting these papers soon for review. We characterize 174 entrances of hospitality venues in 42 census tracts in Madrid between May and September 2016. In those entrances, in those main entrances outdoors, we observe signs of tobacco consumption in more than 80%. We found that entrances had smokers in almost 25% of the main entrances, 24% had tobacco smell, almost 39% had ashtrays, 60% had cigarette butts, and we found tables and barrels in almost 45% of the entrances. and no differences in signs of tobacco consumption were observed between the seasons. And these pictures are made by our professional photographer we have on the research group. Here you can see some entrances that look like as quasi-indoor spaces, like the one on the right side and below. And here you can see what I mentioned you before, that the owners, when they don't have like this permission to have a terrace, they put like tables and chairs. In the first image, you can see cigarette packs on the table and also ashtrays. In the second image on the right, you can see a lot of barrels outside. They cannot put chairs, but they use that to facilitate going and smoking in that places. Or even they put other things to make easy for smoking going outside. And in that last image, you can see this quasi-indoor entrance, but it was funny because here they say that they have a terrace indoors where you can smoke in and is heater. So it was winter, they have heaters in the terrace, so you are free to go inside and smoke in the terrace they have. So both nicotine and PM2.5 increase with the number of lit cigarettes and roof and walls. And it's remarkable to look at the PM2.5 concentrations in the cases where there is 4 walls and 1 roof, so it would be like completely closed spaces, where we can reach concentrations of PM2.5 of almost 80 micrograms per cubic meter, much higher than those values recommended by the WHO organization. And PM2.5 and nicotine also increase in places that the law was not compliant, and during winter seasons. And during that period, between October and December, almost 80% of the terraces were almost or completely closed. So I will summarize the results of these 3 papers and provide some points for discussion. According to our results, we found levels of secondhand smoke exposure above those recommended by the WHO air guidelines in certain outdoor locations and in adjacent indoor areas. Non-smokers reported to be exposed in outdoor areas where smoking is allowed. There was a great support for outdoor smoke-free areas that was strong among non-smokers than among smokers. The highest support was for areas in which children are present and the grounds of healthcare centers. And in fact, those are areas that are already smoke-free in Spain according to the law. Outdoor hospitality venues are areas where non-smoking population continues to be highly exposed to secondhand smoke exposure, and also workers in that places, especially in those terraces completely or almost closed, and when a lot of smokers are present. So should smoking in some sensitive outdoor areas be banned? Some outdoor places are areas where non-smoking populations continues to be exposed to secondhand smoke. But this only happens under some circumstances. However, smoke-free policies favor the denormalization of smoking. So, if we want to promote a positive model for youth and prevent smoking initiation, policymakers should consider banning smoking in some outdoor areas locations. We have observed that support for some smoke-free outdoor areas already exists among the community, and policymakers should take it into account for reinforcing and extending tobacco control measurements. So thank you, all of you, to be here and listen to me. And now I think we have time to make some discussion and if you have some questions. So you have also my email, and I will be here until Thanksgiving. at the Institute, so you can visit also me if you have questions.
Great. Our crew, is this okay? Is this working? Maybe I'll just start over here. So, thank you for a terrific Thank you for a terrific presentation. That was wonderful. So maybe I'll start with the first question, and then we'll open it up. You started at the beginning talking about the Spanish model, and how Philip Morris characterized what was happening in Spain. And that was around what year? Like in the 2000, so around 10 years ago. It was a very big deal that Philip Morris, of course, was trying to get countries to have designated smoking areas and still allow smoking and not go completely smoke-free. So my question to you is, what has Philip Morris been doing since then, and as Spain has tried to strengthen its laws? And so maybe you can just tell us what's been going on from the industry.
Okay. So I think, like, Ernesto Sevrier here is an expert on that because he had a really nice paper about the Spanish model. But yeah, so when we first passed the first law, the tobacco industry used that law to promote smoking bans in other places, taking the Spain model as an example. And all researches and advocacy done in Spain fight against that model and against the tobacco industry to change the law. And with the scientific research we publish and the support of that health administrations and all the politicians and also the community, that it was very important, we could change that law to a comprehensive ban. So I think we did it pretty well, and I'm sure that the tobacco industry is still promoting that model to other countries. So maybe like middle income and low countries are like, so the tobacco industry is pushing them to use that model we had in Spain, but we don't have now, not more anymore.
Questions? Yeah. We'll start.
Thanks, Xisca. Just to build on the question about industry interference, was there any reaction to change the terrace structure, so to remove roofs or walls? And if there was, do you know if the industry helped to educate retailers to do that?
Yeah, so at the state level, we have that law, but in some communities, so in some states in Spain, they are trying to change the law in terraces. It's not at the state level, but so in each community, and I'm not sure if the tobacco industry have interfered on that decisions, but yeah, we are trying to change these laws. I know at the community level, so at the state level, they try, but we are still doing research, doing scientific research, working very close to authorities and politicians, and we want to try to change that law in terraces in a next step.
Question?
Thank you so much. I just want to build on what you've just been talking about, the iterations and updating the laws. Some of the early smoke-free policies in places like California, one of the reasons they were arguably successful was because we changed smoking behavior from indoors and moved it outdoors. And as we've made more and more spaces smoke-free, I think there's a real question of when we're implementing these laws, should we have all hospitality environments, indoors and outdoors, go smoke-free at the same time? Or should there be a step where we get people outside and then further outside? I know in France, when we looked at the effects of the indoor ban, we saw this remarkable effect that the terraces tripled in size. And places like Ireland too. Ireland, the first country to go smoke-free comprehensively nationwide, rooftop terraces and all this investment in outdoor hospitality space flourished, which arguably helped implement a successful indoor ban, but didn't necessarily accomplish some of the behavior changes that we know can come from these. So with all your thinking about sort of what the health effects are and sort of these policies progression, do you think in 2017, when a jurisdiction goes smoke-free, should we go smoke-free in all spaces or do an incremental step-by-step with indoors and then outdoors?
Okay, but you are referring only to the hospitality venues? I should recommend to ban smoking in hospitality venues, both indoor and outdoor, because as you mentioned, so these venues the owners of these venues are very clever, and I don't know if they are pushing by someone, but yeah, so terraces, the number of terraces increases, and I don't know if that's the case of Spain, because we already have a lot of terraces on the streets, but yeah, they use strategies to like think and try to find a way to maintain their customers. And we are now conducting like a photo voice project that is getting the communities involved in taking pictures of their neighborhoods and talking about the problems they have. We do that in relation to alcohol. But it was very curious because the tobacco topic appears in a lot of conversation with people living in the neighborhoods. And they say, okay, we don't go anymore to some bars and restaurants because they don't allow us to go outside with our drink to smoke a cigarette, but it's because of the noises and because so people living there just complain about the noise. That happens in high-income neighborhoods, but not in low-income neighborhoods. So yeah, the owners try to look for different strategies to allow people to smoke outside. I think it should be done from the beginning. So doing a step-by-step laws are not the correct thing to do, because we had the example in Spain. We had a stepwise smoke-free legislation, and it was difficult to change that law because owners invest and put a lot of money to like get these smoking areas indoor, and they were complaining that I have spent so much money in doing that, and now you make me change. So I think stepwise are not the use way to work, and it would be from the beginning that law should be like comprehensive, both indoors and outdoors, at least in hospitality venues. And at the end, people then favor that kind of legislation. So if people get used from the beginning, it's not a problem at the end.
Questions? While people are formulating their questions, let me just ask you, on your slide where you measured nicotine and PM 2.5, it looked like some of the conclusions were a little different, so maybe can you talk to us about why that might be?
Yeah. So here? I will explain you why we measure both nicotine and PM 2.5. So previous literature measuring secondhand smoke exposure outdoors, and we saw that in the systematic review, so they normally use PM 2.5 concentrations because this is it's more easy to measure, it's more cheap, So they prefer to use PM2.5, and it's easy because the nicotine have to be analyzed in the laboratories, and it's much more expensive. But in the systematic review, we realized that PM2.5 concentrations are not so good in outdoor spaces because they depend a lot on the wind conditions, and they drop immediately after people don't smoke there. However, in indoor spaces, PM2.5 are very good markers because they capture the secondhand smoke exposure even after nobody is smoking there and after some days after the measurement. So at the beginning, when we discussed with other co-investigators, and Ana Navas that work here in the Institute was pretty involved in that project, said me, okay, it doesn't make sense to measure PM2.5 because of the problems we have in outdoor spaces. But we know that we had some outdoor spaces that are like indoors. So we thought about the terraces we have in Spain, and we thought, okay, but we have some quasi-indoor spaces. And so we tried to measure both because we have like the instruments to do it, and you can do it at the same time. And yeah, you can see here that, for example, if you look, and there is another reason, and that's because we have like air quality guidelines for PM2.5, and we have previous research, so we can compare results. In nicotine, we don't have that, and we don't have so much articles published using nicotine concentration. So there were two reasons. And if you look at the results, if you look lit cigarettes, both PM2.5 concentrations and nicotine concentrations like increase, what happened with PM2.5? That it depends on the characteristics of the terrace. So if the terrace is very open, the secondhand smoke exposure just disappeared or is difficult to capture. So here there are like some results that maybe are more difficult to understand. If you pay attention to number of roof on walls, what happened with nicotine? That it depends on the number of smokers. But look at the PM2.5. Here is very clear that as much roofs and walls you have, more higher are the PM2.5 concentrations. So here are maybe the question. So I don't know if I respond to your question, but that's why we measure both, and some airborne markers are better for some things, and some airborne markers are better for others. So we have the opportunity to measure both, and with the models we are computing now, we see that difference much clearer.